And one thing that I always think about, one of the first board meetings we had, that we were talking about how do we bring value to the scaling that we're offering for the network. And Ted made a statement to me that really keeps resonating with me is, hey, scale's great, but the network density is what's really, really unique and innovative. And it's always sticking in my brain, Ted. And I was kind of hoping you could just kind of build on that a little bit today.
Yeah, sure. Concentration matters, right? The density is how you define it. And, our network, independent pharmacies, serves segments of the population that simply aren't served by others. So, yes, we have, a significant number of pharmacies that are part of our organization or, are using our products. But more importantly, if you look at the percentage of those in their local markets, in the types of markets that we serve, the population characteristics of the independent pharmacies, we represent a very, very significant, we punch well above our weight, frankly, because this is a market that matters. This is a market in need. This is a market that's growing because it tends to be a little older. These are rapidly growing segments that the healthcare system simply cannot ignore. So it's exciting that we talk about these numbers, but when you really think about those 22,000 independent pharmacies, those 22,000 independent pharmacies are in, not always, but in many cases, they're in areas or geographies that are underserved by others in the healthcare system. Yeah. So it presents us with a really interesting opportunity to just frankly highlight how important this is and the opportunities that exist.
Yeah, it's as you said that to me, it resonates as I spend a lot of time with Jeff and the passion around saving, revitalizing independent pharmacy. There's in my mind now, I've been appreciating not just the opportunity, but frankly the responsibility that we have right now.
And that's a responsibility to a lot of what's rural health. And you think about the life of these entrepreneurial, and I wish we could rename independent pharmacy something else. The big boxes stole community pharmacy term so that it applied to everybody. That it's still more, it's community pharmacy. It's in your community. You look at things that are likely to change with technology, right? We saw a little flash of it in the pandemic. People didn't in the pandemic flood to the big cities, right? They moved out. I think one of the best housing markets in the country and growing is Billings, Montana. I saw on a list was the top 10. So people, and you go to Montana, you don't have a lot of big box stores because you're very spread out. You don't have that kind of density that makes their model work out. And so if you look at what may be a re-ruralification of America, right, community-based smaller pharmacies are going to be necessary. You're going to have a doctor there. You're going to have a pharmacy there. If you go to national healthcare model where drugs all of a sudden overnight are covered, right? Drugs are covered in the United States. You can see a model where they do drugs first before they do healthcare because it's easier. So a lot of interesting things where how do we stay agile, right? How do we create this group that's really agile to move? Because that's supposed to be the sell of the entrepreneur, right? I can make a decision and I can do this thing in my pharmacy tomorrow. How do we do that?
I've done it all my career by just listening to our customers. They'll tell you what they want. They'll tell you what they need. They'll coach you. I mean, you got 10,000 entrepreneurs out there that you can tap into. I mean, not many people have that.
Yeah, that's right.
I mean, I was traveling last week and I went to see a friend of mine's store, pull in the parking lot. And we were talking about pharmacy back in 1980 and pharmacy today. I pull in the parking lot. They're giving a COVID test to a person in a truck out in the parking lot. That never happened in pharmacy before. I walk in, they're giving COVID shots. I got 10 people in line for COVID shots. And then they're filling all the prescriptions. And, oh, by the way, this person's getting fitted for a wheelchair. Mm-hmm. I mean, all that stuff didn't happen 5 years ago in retail independent pharmacy. And, I live in, Columbus, Ohio area. Our COVID shots. I had to go to some big old, factory kind of place that had been repurposed for getting COVID shots. And there were lines of nurses, and you had to wait 15 minutes, and you sat in a chair and they stuck your arm.
Yep.
I mean, rural America, they just go to the independent pharmacy and they know Bob or Sue, and it's all taken care of. They will tell you how to make the network the most effective network that you could ever imagine if you just listen to them.
Yeah, interesting story from Florida. When they first started, you first started, who could get the shots was the elderly, and really trying to focus. And the governor first gave to CVS and Walgreens the shots to get to the nursing homes and to the pieces like that, and gave them a deadline. Of course, that deadline hit, and they hadn't done even near a portion of that. Mm-hmm. And they moved and gave that back to public health. And public health started calling who? The pharmacists, the independent pharmacists they knew about, pick up the phone, calling a guy named Eric we know outside of Orlando. Hey, can you help us get rid of these shots? We don't know what to do with them. And, of course, he said, yes, I can, right? And you put down the phone and okay, how are we going to do this, right? And and as we look at our customers back then, they were working 80, 90. That I got text messages and emails at 2:00 in the morning giving me ideas of stuff to change, right? The workers at those big box stores clocked out when it was time to clock out, right? And that's why they didn't get it done, because they didn't have the capacity to stretch and to volunteer and to do what needed to be done for the community. And today we have 22,000 locations out there who are willing to stretch and do that are entrepreneurial in their communities. And it's something that really got a lot of notice, I think, from public health and from even some of the big guys who are coming to us today and going, hey, we saw what independent pharmacy can do. We really want to work with them. How do we do it?
Yeah, the COVID thing was a boom for independent pharmacy. They proved their value. Like I said, the guy that I went to see was in South Carolina. He was the first pharmacy to give COVID shots in South Carolina.
Wow.
Because nobody could figure it out. He said he gave 1,000 the first week. Yeah, they were doing them in the store. They were going to.
It was crazy.
Crazy the numbers they were doing.
So it's they overshadowed what a lot of other people are doing, and they proved that they're a valuable piece of healthcare. And now I think the onus is on us to say, how do we expand on that? How do we take that and keep pushing and get them deeper and deeper into healthcare? Because people, as consumers of healthcare, we need more access points. You try to go into healthcare today, it's hard.
Yep.
Well, there's 22,000 independents out there that it's not hard. You walk in the front door, they'll take care of you. Mm-hmm. I mean, I've seen so many times where a person, an ambulance ends up at an independent pharmacy because the person walked in the door, didn't know what was wrong with them. They diagnosed and said, we need to get you to the hospital now. I mean, that's what they do. And if we can get them that responsibility and get them paid for it, overall, our healthcare is going to be better and patients are going to be better taken care of.